Hello everyone, welcome to my show. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. And you know my passion is about bringing anti-aging and regenerative medicine in the forefront, bringing credibility into it, and especially when it's combined with functional medicine, nutrigenomics, and nutrigenetics, as you've been learning about. We have so much in integrative medicine. It's like everything that's not conventional is integrative medicine, but a part of this integrative medicine is just exactly what I talk about. And it's not any longer a quackery field. It's so much more, so much evidence based into it. And especially when we talk about certain nutrients, we bring out the science. We know exactly the mechanism and how they act. And I've got an amazing guest with an amazing nutrient to talk about. I've had him on before, and it's been always about the science. We really got into it. But in this show, I want to get into the how do you say, the stories. It's people like you who started using this nutrient and what happened. So it's really going to be more of a lot of stories, true stories, and testimonials, which he'll tell you where you can go and look at those testimonials, and we're going to talk about it. So he's the president and CEO of AMark Enterprises. The company's been around for over at least 10 years. I've got so much research into it. And I really enjoy every time I meet with him because we get into fabulous discussions. His name is Al Sanchez. Hi, Al. Welcome
Hello.
To my show.
Thank you for having me.
And, you know, I know you came on before and we had talked so much about the science, so I want to kind of bypass all of that. But this time I just want to tell, I want to hear, I want the audience to share some of the amazing stories. Remember, we go to these conferences and then we sit down and we talk about the science, all that's done, and then we just start. It's like, hey, did you know about such and such, and did you know about this, or I've had in my own clinic, I'm like, oh my gosh, I got to tell you about what happened with this person. Right. So let's open up that. I'll share some, and you share some. Tell me a story from some of the other doctors or people that have just tried it.
Well, you know, it goes back almost at this point 20 years.
Yeah. Before we go, we're just going to briefly say poly-MVA is. It's a palladium based, right? It's palladium mineral based and B1 thiamine based complex, correct?
So yes, that's what we call it, lipoic acid mineral complex. That's why it covers kind of everything. It's the lipoic acid, the minerals, and then they're complex.
Yeah, and together. So all of the other things that go in is just inclusive, right?
Well, exactly. and you covered it when you kind of said nutrigenomics and nutrigenetics, that we're using nutritional supplements, what our body knows how to use, and now we're targeting them. So drugs have their place, but they do not cover long-term health.
Yeah, and also at the basic level, you're not targeting one specific enzyme. Drugs target one specific thing, right?
Or a pathway, or a pathway. Thing, but that's
you're giving it like basic nutritional support at the cellular level, and that's really what you want to do. And lipoic acid, by the way, just briefly, it's a ubiquitous antioxidant, which means it's lipid and water soluble. It just travels everywhere, right? Universal. Everywhere in your body. Yep. Every part of your body uses it.
Crosses the blood-brain barrier.
Yeah.
Everything.
So having said that, what do you feel like? What has happened with some of the stories?
Well, it was.
Tell me some of the stories that you've done.
I mean they go back to a user of it who had a glioblastoma almost 17 years ago.
So glioblastoma is like a brain tumor.
Right.
Yeah.
And so used it again for the nutritional support, for the energy, for the strength, for the benefit, and still doing wonderful today. Brian is excellent health. He has 2 children.
What was he before he started using this? Was he?
Oh, he stopped paying his taxes because that was it. He tells a great story about how he's like, I'm not paying taxes anymore. I'm going to die. You don't survive from this, and yet here he is. And so he's like, I happily had to go back and pay my back taxes. Wow. He's one story. I mean, countless over the years.
No, let's do it. What's another story?
There's another one. The one that always warms my heart is a young girl. She battled leukemia. I believe it was, I always get it backwards, CLL leukemia, and she was like 2 and 3, and then of course it came back. Then she had ALL as well, and so her opportunity was to get a transfusion from her brother, but because her blasts were so high, well, she met with one of the integrative NDs up in the Northwest. And through a combination of using the poly and some other protocols, they were able to get the blast down so that she was able to have her transfer from her brother. Wow. And she's alive today, and I believe she's 8 or 9 now, and still uses it as a maintenance form. So that it was a great example of how, especially with someone with children, I mean, your heart just goes out to the children whenever they suffer, especially with cancer.
Absolutely.
but in many other situations, you know, animals as well.
Okay, tell us an animal story.
So there's it's actually my father's, what does he have, a Chihuahua. This thing is 19 years old. Coco, by the way.
Wow, a Chihuahua is 19 years old.
So
what have you been giving that Chihuahua?
Poly-MVA, right?
Wow.
It's just amazing. I believe it had a bout with testicular cancer, losing its eyesight, and that dog is still alive today.
Oh my gosh.
It's amazing.
And the average life of a dog is like...
I mean, the smaller dogs live 12 to 15, but
This
at
one
19 years,
wow.
it's just amazing. Again, my father, he's a diabetic, and his kidneys are fine to show how...
We know lipoic acid is very, very beneficial, by the way, in diabetes,
right? Diabetic neuropathy. So this is where the doctors have used it in various protocols. One of the most renowned one would be Dr. James Forsyth.
Yeah.
He's an oncologist in Reno, Nevada.
I know him very well.
He's been doing outpatient studies with integrative care in the poly since 2004. Overall, he's done more than 1,200 patients.
You know, he was been asked to, I think, head the Cleveland Clinic, and he turned it down just because he's just got, I mean, he doesn't meet, I mean, he's so established right now.
And he's trying to work on trying to, you know, share those protocols with others so that they can then take his work and hopefully make it better.
And I know that's an integral part of his regimen is poly-MVA. In fact, I know that he uses IV poly-MVA, and I've got I mean, I use this too, but this is an IV.
There it is.
So there it is, okay? It's right here, you guys, but it's poly-MVA, and IV used for you know, is adjunctional sport and part of the detoxification and so forth for the cancer patients. He's got a whole protocol identified for that, and he's worked with it. So it's almost like, I mean, and this is where I have a hard time understanding that, you know, when drugs come on market, they start with small studies, and of course then they do their big trials and all that. That's how they gain momentum. But how do they start? They started when there were really like just a few, right? They start really small, and they're able to move forward. And we just like, now we have more strict guidelines on nutrients than we do drugs.
To a certain degree, yeah.
Because of the new GRAS guidelines, you know, it's almost, it's so difficult to try to say bring any validity into a nutrient versus a drug that could be pulled off later on. It doesn't matter. They just pull it off the market and say, oh, oops, we forgot, we didn't know about it. But dare that happen to nutrient, and there would be a whole nutrient shutdown. Right. You know, and I think that's a stigma. It's a stigma that needs to disappear. And we need to resolve this. We really need to resolve the fact that just calling nutrients, and in the conventional term, is like nutrients is like junk, or there's just like some like food nutrition. This is serious biochemistry, serious nutrigenomics going on here, serious nutrigenetics. And if we do not learn about it, it is malpractice. I would say the clients and the patients, if they can't get this information, this is pure malpractice for a doctor not to know about these things any longer. I had just had Ron Martin. He's the CEO of Nutrigenetics, and it's actually nutrigenetics.net for those of you who want to go. He's establishing a huge database on all of this is, and he's gone to enough conferences on nutrigenomics as I have, where they are now starting to apply this knowledge. They're ready now to apply this, and they're saying, if you don't learn about this and if you don't know about this, then it is it came out of his words. He said it's malpractice not to know about it any longer.
Wow. That's a powerful statement, but
that's a powerful statement.
But I think it truly represents what.
How can you not? There's certain established facts now on nutrients. There's certain pharmacology. There's a pharmacology of vitamin C, and this is established. It's there. And I have the book on nutrigenetics. It was written by a doctor and a professor of nutrition in North Carolina. I mean, how can you just keep on invalidating it just because it doesn't appear in the conventional medical journals?
Well, and I think it comes back to, one, they don't understand, and two, they're afraid of it, because to realize that nutritional support and nutrigenetics and the nutraceuticals that go along with this can be that simple, because there isn't $1 billion plus in vitamin C. There just isn't. It's very inexpensive and easy to make. So there's no incentive for them to do so. However, in the medical field, and this is where I think that statement is powerful that he says about malpractice, that if you're not giving your patient the opportunity, and you're doing harm versus help, wow, that's a powerful statement. The doctor has to look at what they have to do.
In that perspective, I'm just saying, we as as integrative physicians always get put in that perspective, like we're doing quackery, we're doing this and that. Well, what about what about certain established facts that exist in nutrition, and the doctor's not supporting that, and that's not malpractice to be telling them. It's not malpractice when the hospitals are giving inflammatory foods right after surgery. That's not malpractice. Why are we not seeing lawsuits in that regard?
Right.
Why are we seeing lawsuits all the time on doctors like myself and people who represent actually doctors who do serious biochemistry, know their knowledge, and we get attacked all the time? Why is that not happening?
I think, again, it's easier.
It's so irritating sometimes.
I can see you're passionate about it because, again, we've seen the difference that it makes in your patients' lives, specifically for you, and I've seen the difference it makes in other patients' lives.
Yeah.
So I think we're both working in the industry to change that, and it has changed. I think you've seen that over the past 50 years.
Actually, it has changed. So there's definitely more. The nutrigenetics conferences, there are just jillions of them now. There was only like one or two a year.
Every now and then. And the wonderful thing about it is that we don't have to make anything up, right? We don't look.
No, it's already.
I love comparing. Look at your patient. Let's just compare patients.
Yeah.
That's all. Outcome-based studies on the patient's survival and their quality of life. And you tell me what works and what doesn't. Because I've seen the studies, I've seen the research, especially in cancer care, where the chemotherapies, the radiations, and all they're targeting is for 5-year survival. And yet the patient is on all these medications, they're suffering, they're in pain, they've been burned from radiation. Really? That's your bar?
Yeah.
That's not our bar. That's their bar.
The bar has to be, you've got adjunctively. We're not saying, okay, don't, but at least consider this. And how do you know by not supporting all of that, and learning all of this and integrating it,
and you could have the best.
You could have the best because you could let less treatments and so forth. No, absolutely. Listen, the polymva.com is where you guys can go to learn about this nutrient. It's a phenomenal nutrient. I've used it so much. I think the reason I really wanted you and I had you come back on the show is because it's just not that well known about still. We need to get this word out. So it's a movement. I want to start this as part of the health revolution. I think people need to empower themselves, and I bring the best. I really do. I'm confident that I bring the best of anti-aging, regenerative, and nutrigenomic medicine, and this is one of them. So polymva, polymva.com. Learn about it. There you can go in and they can contact Al Sanchez on the research, the clinical research, the studies. He'll point you out to how Dr. James Forsythe's been using it. So absolutely. And if you want to contact me at NainaMD, NainaMD.com, I'll tell you about it. But either way, hit us up and we will tell you about polymva. So I'm going to be right back with my next guest at NainaMD, Fusion of Science and Beauty, right here in Beverly Hills with a fabulous guest. Thanks, Al.
Thank you for having me.
We'll be right back.